founder director at Emoticons India. And she's going to talk about mental health. As I'm going to ask her a few questions, a very warm welcome to you, Nikunja, to the Mental Health Carnival.
Thank you.
Nikunja,
Thank you, Mrs.
my first question to you would be, why is mental health important?
Right. So, see, the thing is, all of us have mental health. Yeah. So I feel the question should not be about why it's important, because everyone has it by default. The point is, but how many of us are really mentally healthy? Yeah.
Right.
And mental health or deteriorating mental health, it does influence many areas of our life. It starts influencing our thinking, our feeling, and our behavior. That's what psychology is all about. And it impacts all the areas of our life, including our day-to-day routine, to our careers, relationships, I think even physical health. And all of us do talk about physical health, but many of us are not aware that just the way we have physical health, we have mental health too. And there is absolutely no exception to that if I am belonging to, let's say, psychology profession, I do not have mental health, right? So including any housewife to any other designation that is of psychologist, everyone do have a mental health, which they need to take care of. It doesn't have any restriction of any gender, age, religion, culture. So yeah, I guess that's why everyone needs to know this, that there's a difference between being mentally healthy versus having mental illness. Yeah.
Very well. Very well. I think that makes a lot of sense. Uh, Nikunja, next question would be, why do you think it is important to talk about visiting a mental health practitioner?
Right. Um, so definitely this is a very usual question that we hear from the immediate surrounding also. And I think the research also states that, the WHO has done a lot of research, of course, and it states that 20% of world's population suffer from mental illnesses. Yeah, which means uh, around billions of people worldwide, they suffer from mental illness at least at some point of time in their life. Yeah. And the fact that in spite of this, if people are not willing to go to mental health practitioner or a professional, it reflects actually, I think, few of the reflections. It could be that there's a big lack of awareness about this field of mental health. B, people are very reluctant and very ashamed of it. They are very ashamed to admit it. And perhaps the C is mental illness is still highly stigmatized.
Yeah.
Yeah. Why should one go for mental health professionals or to mental health professionals is because they provide a very personalized support. And in comparison, they are very, very less biased towards the problem that you go through. And what I feel in my practice is I always let even my clients know that the problem is not you. You have a problem which can be worked upon. Yeah. So seek mental health under what we call in Emoticons also a 3D model. Yeah. Seek mental health either when you have a disorder, B, when you go through even day-to-day distress, and the third D, even if you're looking for some development and skill building in your own personal life.
Yes.
So any under these three situations, one shouldn't hesitate to go for mental health professionals. After all, we all definitely go for or work on our physical health, right? I think that comparison, though is right, left, center used, but it's very important and easy to help others know that the way we go to gym, we work on our muscles, the same way we have to even work on our brain muscles, right? We also have to work on our, perhaps I would say, thinking, feeling, and behavior. And what I feel is physical health and mental health are not too different if you really look at it in a way that mental health is actually the physical health of your brain.
Yeah.
Yeah. So that's why people should not really hesitate to visit a mental health practitioner.
Lovely. So I think for my next question, you've partially answered it, but anyway, I'm going to go through it again. So what are the signs that the person should look for to seek a mental health practitioner's help?
Right.
So besides what you
So when
mentioned, if
some
you could share something more.
Definitely. In fact, I would like to share this one dialogue or a conversation I had with one of my relatives, where knowing that I'm a psychologist, you keep getting such questions or requests. So I had this entire dialogue and a conversation that I can recall where, when do I know that I have some problem and I should start visiting a practitioner or a
Mm-hmm.
counselor? To which we had a nice conversation, and I told her that, do you or have you ever observed whenever you get fever, you already start feeling beforehand that, oh, there is something going to happen to me. Yeah,
Mm-hmm.
your body starts paining or you feel very lethargic, right? So you kind of know that fever is going to come.
Mm.
Yeah, same way, how about we all observe some of the signs? Of course, there are many, but some of the, I would say, predominant one, we can
Mm-hmm.
start observing.
Mm.
If I have overall loss in my happiness, is my health getting deteriorated? Are there different kinds of mood swings I'm going through?
Mm-hmm.
And even if I'm losing some interest in my day-to-day activities or wanting to socially withdraw, yeah, I mean, during this entire COVID-19 scenario, social distancing is perhaps important, but not social withdrawal, right?
Very well.
And of course, daily functioning, that's another thing which highly gets affected. And it gives you a sign that, okay, it's a red flag that I perhaps need to seek professional help, perhaps need to go to a mental health practitioner. So,
Right.
yes.
Great. So my last question to you, Nikunja, is what is the one message that you'd like to give to the viewers who are watching us live today?
Right. So, I would like to let everyone know, and rather ask everyone that, has it ever happened that perhaps you were crossing the road and you saw somebody meeting an accident, right? You wouldn't hesitate to go to that person and offer some help.
Yeah.
Yeah. So the same way, how about all of us really start being concerned and empathetic even towards those people whom you can observe and you might see in your day-to-day life, probably crying, feeling very anxious, feeling very stressed, right? What's the worst that could happen is they might say it's none of your business, or they might say thank you, I'm fine, right? But what best can happen is you will really prevent someone from harming their own self or even harming others.
Mm-hmm.
And I don't think so that that's going to cost anybody much, isn't it? You will
Yep.
elevate unwanted suffering for somebody and get them some help. So I think that's one thing I would like to let everyone know, that observe, because there are mental health or mentally ill people even around you. You may
Mm-hmm.
just not know it, but they are still around you.
Right.
Yes.
So if Nikunja, somebody has to get in touch with you, how do they connect with you?
They can visit our website, that's www.emoticonsindia.com, or they can write us on an email address, which is also mentioned on our website. And they can, of course, anytime connect with us through our social media platforms.
Great. So is there anything else that you'd like to add before we wrap up the session?
I think I would just say that this is a great cause that we are coming together for. And while the science and medicines, they still work on their research, they work on finding the causes and the cure for mental health, people like you and I, and even people who are watching us live, they need to come together for this better cause, because taking the stigma out, it cannot really start from preaching. Yeah, it has to start from you applying it on yourself and you following it, right? It's what we say, walk the talk,
Yeah.
right? So the same way. And so I would like to let everyone know that please do catch us for the Mental Health Carnival Marathon on the 16th of October for an interesting panel discussion on the mental health of the mental health practitioners. Thank
Thank,
you.
thank you so much, Nikunja, for being part of this carnival, and it was lovely having you.
Thank you so much. Thank you. It was my pleasure too.